You know that feeling. You've got a pounding headache, you pop a pill, and then, almost like magic, the pain just starts to melt away. But have you ever really stopped to think about what's going on in there? Because it's not magic. It's a fascinating and surprisingly complex bit of biochemistry. So, how does that little pill actually work? Let's dive in.
Today, we're going to unlock the science sitting right there in your medicine cabinet. We're going to follow a pain signal, right from the very start, all the way to the moment a painkiller shuts it down. And trust me, what we find along the way involves a major twist.
All right, so here's our game plan. We'll start with how your body even sends a pain signal in the first place. We'll meet the little chemical messengers that are basically screaming ouch. We'll see exactly how drugs shut them up. And then we'll uncover that surprising twist, a trade-off that has some really serious consequences. I promise, by the end of this, you are never going to look at a bottle of ibuprofen the same way again.
Okay, so let's start at the beginning with your body's built-in alarm system. See, before we can understand how to stop pain, we've got to understand why our body even creates that feeling in the first place. You know the drill, right? Whether you sprain your ankle or catch the flu, your body rolls out this classic trio: pain, fever, and inflammation. But here's the thing you have to get. These feelings aren't the problem. They're the warning lights on your body's dashboard telling you something's wrong. So the real question is, what's flipping the switch? Well, it turns out there are these tiny chemical messengers, and their whole job is just to spread the news about an injury. Let's meet the culprits behind the curtain. And they're called prostaglandins. When any of your cells get damaged, they release these little compounds. Think of them as the town criers of your body, running around and yelling at your nerve endings. Hey, problem over here. They are the direct cause of the pain, the fever, and the swelling that you feel. Okay, so if prostaglandins are causing all the trouble, the solution seems kind of simple, right? Just stop making them. And yep, that is exactly what painkillers do. The best way to think about it is like they're shutting down a factory assembly line. Every factory needs raw materials, right? Well, in our body's pain factory, the whole process kicks off with something called phospholipids. They're just a normal part of all our cells. But when a cell gets damaged, these guys are released. So step 2 on the assembly line. Those phospholipids get turned into the next ingredient, a fatty acid known as arachidonic acid. We're getting closer to our final painful product. And here we go. This is the final, most important step. A master enzyme comes onto the scene. Its name is cyclooxygenase, but everybody just calls it COX. This COX enzyme is the foreman of the factory. It takes that arachidonic acid and turns it into those prostaglandins that cause all our misery. So you can see the whole production line right here. So how do painkillers, what we call NSAIDs, actually work? They literally throw a wrench into the machinery. They go in and they block that foreman, the COX enzyme, and stop the factory cold. No COX, no prostaglandins. No prostaglandins, no pain. Sounds beautifully simple, doesn't it? Well, not quite. And this is where the story gets really interesting. Because it turns out the COX enzyme isn't just one guy. He has a twin. And one of them is actually essential for keeping us healthy, while the other one causes all the problems. So let's meet the twins. On one side, you've got COX-1. He's the good twin. He's always on duty doing crucial housekeeping jobs, like creating the protective lining in your stomach that shields it from its own acid. Super important. On the other side, you have COX-2, the evil twin. He basically only shows up when there's an injury, and his only job is to fire up that prostaglandin factory. So this is the absolute key to understanding your painkillers. They fall into 2 camps. The older, non-selective ones are like a sledgehammer. They go in and they knock out both twins, COX-1 and COX-2. Yeah, they stop the pain, but they also stop the good twin from protecting your stomach, and that's why they can cause ulcers. The newer drugs, the selective ones, they're more like a sniper rifle. They're designed to only take out the bad twin, COX-2. Okay, so sledgehammers versus sniper rifles. How does this actually play out with the pills you probably have at home right now? Let's take a look. Here are the workhorses, the sledgehammers. You definitely recognize these names: aspirin, ibuprofen. They work great, they're effective, but you have to remember, they're taking out the good COX-1 enzyme too. And that's where that well-known risk of stomach trouble comes from. Now let's zoom in on paracetamol, which you might know as acetaminophen. It's much gentler on the stomach, which is great, but it has an Achilles heel: your liver. At a normal dose, your liver handles a toxic byproduct with no problem. But in an overdose, or with chronic heavy drinking, that system gets completely overwhelmed. And that can lead to severe liver damage.
Aspirin has its own very unique and frankly scary overdose profile. It starts by messing with the breathing center in your brain, making you hyperventilate. This leads to a condition called respiratory alkalosis, which is reversible. But if it keeps going, your body chemistry can flip into a much more dangerous, irreversible state called metabolic acidosis. So to get around the stomach problem, scientists engineered a brilliant solution: the selective COX-2 inhibitors, those sniper rifles. Drugs like Selexicab. On paper, they were the perfect painkiller. All the pain relief, none of the stomach side effects. They were seen as a total game changer. But there was a catch.
And here it is. It turns out that the good twin and the evil twin, COX-1 and COX-2, exist in a very delicate balance that helps regulate blood clotting. By only blocking the evil twin, COX-2, these new drugs threw that whole system out of whack. The result was a significantly increased risk of blood clots, heart attacks, and strokes. The perfect solution had created a new, and you could argue, even more dangerous problem.
Which brings us to the biggest lesson of all here. When it comes to powerful medicines that change your body's chemistry, there is just no such thing as a free lunch.
There is no magic bullet. Choosing a painkiller is really about choosing your risk. Do you go with the sledgehammer and risk stomach issues, or do you choose the sniper rifle and accept a higher risk to your heart? It is always, always a trade-off. So the next time you reach into that cabinet, remember what's really going on. You're not just popping a pill to stop a headache. You're making a calculated decision to interfere with a complex biological factory, and you're making a bet in a high-stakes game of risks and rewards. The only question is, knowing what you know now, how does that change the way you see that bottle?